Hi everyone, my name is Yousaf Ilyas and I'm a first year medical student at the University of Illinois College of Medicine. And today I will be presenting our group's poster, which is titled Comparing Final Outcomes in Conservative versus Invasive Methods in Treatment for Burst Fracture in Octogenarians. Starting off with some background, burst fractures usually result from axial compression and they're often combined with flexion forces, which may cause the vertebral body to shatter. And typically they're due to high-speed trauma such as car accidents or falls, and they're extremely common. In fact, some studies have actually estimated that burst fractures account for up to 15% of all spinal fractures. However, despite their prevalence, there currently does not exist any consensus best treatment for patients who have burst fractures. Multiple studies have been done examining surgical versus non-surgical treatment in these patients, and no consensus has been reached. Furthermore, high-risk groups such as octogenarians present more complex medical management in spine surgery, given their high age as well as the potential for many comorbidities. And as such, our study sought to examine whether octogenarians who have undergone treatment in the surgical for burst fractures with a surgical method had different outcomes when compared to non-surgical methods. And moving on to the study design, we collected data from the National Trauma Data Bank from the years 2017 to 2021 for all octogenarian patients who had ICD codes for burst fractures. And we then divided these patients into two groups, surgical treatment and non-surgical treatment. And in order to achieve balance between these groups and make sure that we accounted for biases, we did propensity score matching on different variables such as patient demographics and comorbidities. And after doing so, we ran different analyses to analyze different outcomes such as rate of hospital complications, intubation rates, length of stay, and mortality. And we found that the surgical group experienced higher rates of reintubation as well as longer hospital stays. However, all other complication rates, as well as mortality rates, were insignificant. As such, these results suggest that surgery and conservative treatment may offer similar results, with surgery obviously offering a longer amount of stay and potentially increase hospital costs. And as such, these results emphasize the need for personalized decision making within these patients. And to conclude, I would like to thank the LSRS for giving us an opportunity to present this research, as well as my co-authors, Hadil Mansour and Dr. Murtaza Sadeh and Dr. Ankit Mehta, who have provided invaluable mentorship and encouragement to pursue this project. Thank you.